The point of this morning's briefing is to just facilitate a discussion locally on the efforts we're taking to contain and combat the spread of the coronavirus locally. There's been a lot of news stories out there recently. There's a lot of concern, I know, among members of the community. And I think it's important that we all come together, compare notes, and discuss what's real and what's not about some of the things you're hearing. I know this is a problem that is going to require a whole of government effort, starting with the federal government, but extending to state and local governments. We have passed an $8 billion measure through the Congress that was signed by the President this morning that will fund critical efforts that are needed to effectively combat the coronavirus in the United States. That $8 billion will include nearly $1 billion, $950 million for states, localities, and it will include $350 million that is undesignated and that will be allotted as outbreaks develop. Now we know as of today that there are approximately 22 cases in the state of New York, including some in the Hudson Valley, and so naturally New York will be the recipient of a significant portion of those funds. Exactly how that will develop is not totally clear right now because it will depend on the course of the epidemic. In addition to that, CDC also has undesignated funds, and a portion of those funds will be used for New York so that we can get smarter about identifying areas of potential exposure and let the public know where and when they're at risk. The Strategic National Stockpile of medical devices will also get dedicated funds in this package and will help support states as they run low on certain supplies if they are needed, such things as medical devices or masks or respirators. That's the point of that funding. Community health centers, which are so important to our efforts, will get at least $100 million to prepare to treat patients. And there will be dedicated funds for research and the development of vaccines. And of course, many New York companies and entities will be eligible for those funds as well.
We do have some funding coming down the pipeline from the federal and state government. We've been advising our municipalities to document any spending they do, just like they do doing any emergencies we've experienced in the past. Other questions? We do have supplies that the county has, N95 masks and so on and so forth. That is being kept and being used and distributed only on a case-to-case basis with emergency providers that don't have the proper PPE. If they don't, we have given some advice out. Dr. Gelman will be talking later, our health commissioner, and there's a ton of good information out from the CDC and the New York State Department of Health. We also gave out some advice on municipalities and businesses on practices that they could employ in their particular institutions to try to improve workforce, sanitary things, as well as talking about telecommuting. So those all came up. So we've been getting some requests from municipalities in Orange County, I'm sure Marcus as well as Hudson Valley, what to do with big gatherings. A large gathering is 5,000 and more, but there are some things like that are coming into question. Our health commissioner, which has a lot of power in these type of situations, and the health department are weighing in on that and giving advice to local either municipalities or whoever's hosting that event on whether they should go forward or not.
We take care of the underserved, the uninsured, the people that may not want to access health care if they don't have access to it, and they're going to be coming through our doors. So in addition to those 40,000, so we're going to be ready for them. And I think the key is we want to keep this away from the hospitals. My biggest fear is, we need to slow this epidemic down so we're not overwhelming the health center and the hospitals at one time. So we want to keep it all in the outpatient as much as possible. What we've done, we haven't really found this is much different than what we should have been doing all along. The same steps we've been taking for flu. Masks to sick people that come in, making sure everyone's using PPE appropriately. But we've been meeting, we're in touch. The Orange County Department of Health is wonderful. We're in touch with them daily. We're on the protocols we have put in place on the phone calls when people call our health center. The first question is, have you traveled in 30 days? Have you have symptoms of cough, shortness of breath? If you are, we don't necessarily need to bring you in. So we're really going from a side of prevention. And that's how we're looking at this. And we're, respiratory stations up front and just preventing the spread. And you're right, I think it's really important. And we're going to be there. We're going to be part when the testing rolls out. it's going to be coming through us. It's all we know. I just think interesting to think about. It's the tip of the iceberg what we see right now. We know who has it. We don't know underneath it how many people really have it. Maybe a lot more, and they're fine. And the only way we're going to find that out is once we get the testing going. So I'm looking forward to being a part of that. As a pediatrician, I don't know what to say. As far as I've seen right now, it hasn't affected the kids, but we'll see. We would want to be more careful with the asthmatics, but the kids tend to be safe right now, and I think it's because they've been exposed to a lot of corona already, the non-COVID-19.
A lot of this is just prevention of spreading to our non-infected patients. So just education on if you're not really sick, you don't need to come to the hospital to be tested for COVID-19. Just like any other situation, especially related to the flu, if you can't breathe or you're acutely ill and you need to be in the hospital, 911 is now screening patients for COVID symptoms, so we can get that heads up to expect a patient who may need isolation, and we're ready to put those patients in isolation and contact health departments to do testing appropriately. Still, statistically, the likelihood of any individual dying from this illness is so much less than the risk that they die from flu or a car accident or smoking-related illness. So I would say to still, use best judgment, but in general, not to massively impact your life.
Change some of our visiting hours, eliminating kids under the age of 12, and minimizing the number of visitors that are entering the building. So just 2 visitors to a bedside. A lot of our focus has been on educating our staff, making sure that we are communicating very well with our medical staff and our community medical staff, making sure that we are educating the community. We've been working with our community partners and the community centers to ensure that everyone understands what we're looking for is, call ahead to the provider. Stay home, isolate yourself if you're feeling sick, and obviously if you're short of breath and having high fevers, that then we'll call ahead to the hospital so we can be prepared to be able to keep you and everyone safe.
I think the most important thing is educating our physicians, who can then educate our patients. Understanding that the most vulnerable people are the people who are currently in nursing homes, currently in the hospital, and currently in the physician's offices. The worst thing that can happen to those vulnerable patients is to have someone who's healthy otherwise, who has coronavirus coming into the office and infecting the office. It is a pretty contagious disease, but in someone who's otherwise healthy probably would not have a significant issue. But protecting those patients that are the most vulnerable is our first goal.
What we've done to medical school is we've restricted travel. None of our medical students will be doing any international travel for the time being, and domestic travel, only essential travel will be allowed, and we're really trying to limit that. We also get visitors from all over the world. We were scheduled to have visitors from Russia this week, traveling here to see our medical complex and our library. We've canceled that, and we've canceled a lot of other similar events. And next week, we're actually going all online. Instead of having the students come to the medical school for instruction, all our courses have been moved online through Canvas and Zoom. And that's how they're going to continue their education, but without congregating at the school.
With the CDC's reported significant escalation of urgency and severity, the goal of the ongoing public health response has slightly shifted from the containment of the outbreak and prevention strategies to sort of battle the sustained spread of COVID-2019 in the community, and really just risk mitigating strategies. Have issued guidance for colleges, for schools, K through 12, as well as daycare centers. And we are following actually our standard pandemic influenza protocols. I will mention that I was very glad to see the funding package, and specifically the fact that it includes a provision for telehealth and remote access services. That was imperative for battling any outbreak, specifically this one. I will say the threat is present. There will be new cases overall, but the risk remains low to Orange County residents as well as residents in the U.S. in general. people in communities can take really kind of the initiative to help slow the spread of illnesses, and practicing non-pharmaceutical interventions now will really help with that. So what I mean by non-pharmaceutical interventions are for personal measures, the personal protective equipment such as gloves or anything that you need along those lines. So please vet your sources, please contact your local health department, make sure that you're confirming the information, because we have been dealing with quite a bit of phone calls just kind of dispelling rumors and exaggerated information.
What we've done is we are preparing for whatever we need to on a scaled basis. So those plans include everything from communication, including communication to the public. So today we actually launched public service announcements via the email addresses that we have in order to get information, as all the panelists just talked about, to people so they have it in hand. It also particularly goes to being able to manage our capacity. And so we're doing scenario planning that says, if this many, then this, if this many, then that, and then if this many, that. And that includes everything from managing our beds to assumptions around if our own staff were impacted by the flu and by the COVID-19 and began to call in or grew sick, how we would manage the capacity that we have, or the capacity that would evolve as more and more patients come to the organization. We appreciate everybody's effort to manage the rumors, because there are a lot of rumors and they're not particularly helpful at this point for us to be able to manage the health and well-being of the community. We also appreciate everybody's effort to not send people directly to the emergency department, because once they come to the emergency department, then we have to care for them. And we have to go through the protocol and the screening and be able to work with Dr. Gelman's team and the folks at the state to ensure that if people present, we go through the screening protocol and ensure that we manage them appropriately. That then takes up capacity for patients that are really ill and need the care that they can only find in an acute care hospital. And the major message is, if you have symptoms, stay at home, call your provider, get guidance, and then if you're really ill, come to the hospital and we'll take great care of you. Thank you.
One of the things we're trying to get ahead of is information coming from our providers, our call center, anyone who works for our organization, that they need to have the right information in a timely fashion. They need to understand what the risks of COVID-19 are, what we know so far. And in order to communicate out to our staff effectively, emails are not enough, flyers are not enough. We have to meet people face to face. So, and we really do have very timely information. And if we're able to communicate that in the right way to our staff, then that should spread to the patients and help alleviate a lot of the anxiety and worry in the community.